Our next speaker comes from Afghanistan, one of the most conflicted areas, and specifically when it comes to refugees, that as he sadly shared some experiences, Afghanistan is among the senders of refugees around the world, and millions of Afghan refugees, because of the prolonged war and conflict, are refugees in other countries. I'm so privileged that Dr. Wahid Majrooh, my close friend and the director of the Afghanistan Center for Health and Peace Studies in Geneva, and the founder and director, and he was the ex-public health minister in Afghanistan by the beginning of Taliban and before that. So he's bringing a national perspective as a high-level politician, as the minister, and now involved in that, to see how the context of Afghanistan has been affected by that. Wahid, please.
Amir put a higher load on my shoulder by explaining that I had the opportunity to serve my people in different contexts, not only before the takeover of Taliban, but as the only politician who stayed in Afghanistan and served Afghans with pride beyond the collapse of the Afghan government. So what I can quote today, what I can narrate today, is a story of the complexity of the context in a war and conflict-torn context. Could it be Afghanistan, Sudan, Iraq, Lebanon, and with the troubles, with the challenges that our politicians are making, unfortunately, could be several other geographies that we are not competent enough to think of today, but unfortunately, it is unfolding. Given my experience, not only in Afghanistan, but in the region, when it comes to the context and the competency and the skills that the global health experts and humanitarian aid workers are equipped with, it is mainly focused, and that's unfortunately rooted in how we are trained as medical doctors or public health experts, what health is, what health facility is, and what vaccine is, what is infectious disease is. But the problem is that by the time you enter a conflict zone, a war-torn community, society, the challenges you face, the needs you hear, and the ones that you're expected to address goes much more beyond you were taught in your chapters, or you have read in the books or research papers that you had access to, especially if you are privileged to come from the Western side of the world. What I've witnessed is that in communities and societies like Afghanistan, which matters is that we have the understanding, the perspective of, in the cultural competence on how to communicate with people, how to get engaged with, how to read them, and how to talk with them. One of the issues that we lesser invest in is to know the language of people. It is not English or Persian or Pashto or Arabic, but how they define pain, how they shape hope, how they ask and thank for the support you provide them. That is something we lack. The geopolitical factors in the political context in which we operate is another aspect that's unfortunately less looked at, and that's why, while in an era where every other role player, especially the politicians, has failed to bring hope, the healthcare workers and humanitarian aid personnel remains the only source of hope. The outcome of our efforts is not meeting the expectation, not due to our intention, not due to the level of our investment or our technical capacity, but our capacity to listen to people the way they were culturally trained in. to analyze and look at that community and society in the conflict that were there to address their health needs from a political perspective as well. The geopolitical factors that are affecting that context and contributing. So with that said, what I want to highlight in this session is that this is a time for us to focus on two issues. First, the capacity of the healthcare workers and the health personnel that goes beyond the health facility. Our politicians has failed to lead the world. Once at the WHO Executive Board, I talked about it, that we need a comprehensive VIP high-level psychological screening of the VIP global leaders. You laugh, but I don't. They laughed at EB. Most of them are unfortunately crying today. It was 2.5 years ago. The outcome of such a sample screening will shock you to see who the crazy people are leading this world. But in every crisis, there is an opportunity, especially for us as healthcare workers. This is the time to take this opportunity and equip our staff members, our institutions, with skills beyond technical topics like vaccine or infectious diseases, to make sure that by the time we step in, we can analyze the situation politically, culturally, while having the geopolitical landscape in perspective, to ensure that the effectiveness and efficiency of our efforts goes beyond our health centers. And that's where we can claim that we value, we invest, and we understand what is called the context. I thank you.
Thank you very much. This is exactly what we need when we talk about the new models of health governance or governance for health. It's not necessarily about the government. It's about empowering the societies, empowering people, and those empowered people can make people accountable, which is very important. Vahid, could you share the experience of Afghanistan, if you have any examples that you have done for innovative ways of governance?
There are several examples, but what I want to highlight today is the role that our community health workers played. And the reason I focus on that example is to present a vivid example of the resilience of Afghan women and girls. As the only women and girls around the world who are systematically deprived today from access to education and work. But that part of my society was, are, and will be the main bridge between the government from the health sector and the communities. In Afghanistan, where we incorporated the CHWs within the primary health care system, they are recruited from local communities. The least investment is required, but the amount of the return on investment as a result of their commitment, the understanding of their societies, their culture, the context. And I agree with the lady which talked about how sensitive it is for a healthcare worker with a good intention to advocate for peace and then unintentionally creating a challenge. And that's where the Afghan community health workers, who were in several instances the only signs of government's presence in remote areas for years and decades, who are the real champions of declining the maternal mortality rates and sustaining health service delivery in the peak of conflict, were not only the healers of physical pains, but the communicators of peace. And that's where the significance of cultural competence and the social wisdom comes in. The problem is not how it is communicated when it comes to peace, but the problem lies when we look at complex multidimensional topics like peace from a technical and unidimensional perspective. And that's where only providing a workshop on a specific topic of leadership in health or health diplomacy, there are some very good fashionable words today coming into global health. Yeah, and that's not something that will create wise institutions and health advocates. That will create further mistakes and misunderstandings. In my context, in Afghanistan, our community health workers remained in their societies, as rightly said by Asi. They were the bridge for communication in health service delivery. They became examples of hope, resilience, dedication, and an example of the capacity of communities at all, and women and girls, in a society where gender-based violence has been prominent, unfortunately. So with that said, what I want to highlight is that innovation in health does not only always means to bring AI technology in a village, or a high-tech CT scan machine or MRI in a health system. But it depends on how you understand the problem, as I said, the definition of the problem, and how strategically your investment is oriented to make sure that the return on investment is not only the health, but beyond that. Because when my community health workers were working in remote areas at midnight, serving their people, they had the knowledge, the capacity, and the network not to analyze the pain the lady was suffering, but the socio-cultural and political environment where she was stuck in, and how she could help her being referred to another health facility. That is the complexity and the comprehensiveness that we need in our global health curricula. Thank you.
Thank you very much, Fahid. And thank you. Dr. Mashidiso, we have almost 3 minutes, and I want to be very provocative and ask each panelist to give 2-sentence maximum, the takeaway message, and then I wrap up. Simon, please. Ladies first.
Mental health. Ensure that we have psychosocial support.
Thank you. Asi, please.
Be there before, during, and after.
Great, thank you. What's addition? Please.
There's no primary health care in conflict settings. So we need to invest in that.
In PhD. Thank you. Vahid.
A call for a paradigm shift in global health curricula. And the second, I do not agree. Health is not politics or a political topic. It is, we have to be ready to address it with our health agenda.
Thank you. Shadi.
So I would say we should believe in the power of the global health community to be a very strong advocate for peace and health.
Thank you. And Helen?
No impunity for the war criminals who are carrying out these crimes.
Thank you very much. We discussed many things. I don't want to repeat.